Welcome to Topics and Tips Tuesday in the Nursing Studio. I am Dr. Brittany Weinstock, family nurse practitioner and founder and CEO of the Nursing Studio. And y'all know, on Tuesdays, I provide y'all with topics and tips to help you on your journey. So today, let's talk about the basics of tuberculosis. We'll cover how to diagnose, how to treat, and latent versus active phase. So initially, how you want to start is by a MAN-2 test, which you commonly know as the PPD. It's an intradermal injection that is applied, and within 48 and 72 hours, you assess the measurement of that. Based upon that induration millimeter size, you want to measure it with a tuberculin ruler, and that person's past medical history will help you with your diagnosis. So you see here where they have the injection. Next, you'll see this image of how we're measuring with the tuberculin ruler. Again, based upon the millimeter induration, which is that raised area, that's how we're going to assess and diagnose. So people with a 5 millimeter induration are positive if they're immunocompromised, like those HIV patients or those who are on chemotherapy, and people who have been in recent contact with someone who has been diagnosed with TB. 10 millimeter induration, people who have traveled to prevalent TB locations, as well as people in highly populated areas like healthcare workers in hospitals, prisons, and those children under the age of 5. 15 millimeter induration goes for our healthy population, okay? So then you need to determine if it's latent versus the active phase. So in the latent phase, people test positive based upon that positive MAN-2 test, but the chest x-ray, sputum culture, and symptoms are negative. Whereas in the active phase, everything is positive. The PPD as well as the chest x-ray, sputum culture, and their symptoms. So you have to remember that the gold standard is sputum culture and chest x-ray as well, but sputum cultures are first-line therapy. In the latent phase, we treat with INH, rifampin, and ethambutol. And in the active phase, you also treat with INH, rifampin, ethambutol, and you also include pyrazinamide. Next, when you're evaluating a chest x-ray, I want y'all to know where to find these things. So you will see changes in the upper lobes on the chest x-ray, most commonly in the right upper lobe. So that's all for my tips for you guys today. Continue to follow the Nursing Studio. Be sure to like, subscribe, and share this video. Follow us on Instagram and on Facebook. And I look forward to seeing you guys again right here next Tuesday, okay?